This next chart is from The Economist, and if you're familiar with The Economist magazine, you will recognize their style in terms of font and structure of images. And over here we see something from a corruption in healthcare systems report, which indicates the extent of illicit payments, also known as bribery, in the European healthcare system. Now, both Europe and the United States have major flaws in their healthcare systems because this is not an easy problem to fix. The flaws in the United States are well known. There's such a thing called health insurance, which is often dependent on one's employment. And if you lose your job, then you also lose your health insurance, and then the costs can be catastrophic. What is even worse about tying healthcare to employment status is that during a recession, millions of people lose their jobs, and therefore millions of people also lose their health care. So the net anxiety and pessimism across society is very substantial, which prevents an economic recovery from being as fast as it could otherwise be. Now, there's a certain category of Europeans who are very, very excited about criticizing America in every possible way. And one of their favorite subjects to criticize the United States over is healthcare. However, it is not nearly as well known that European healthcare itself has huge problems, such as the fact that you often have to bribe the doctor in order to get an appointment. So in creating a universal healthcare system, Europe has ironically fostered one of the worst aspects of capitalism, which is that people who are wealthier and shadier, as in they're more inclined to bribe and know how to give bribes, are getting better health care than other people because they bribe the doctors to get an appointment. As you can see over here, patients in Spain wait an average of 123 days for an operation, the most in 18 years. And in this first chart over here, you can see what percentage of bribery instances there are per appointment, the prevalence of informal healthcare payments. Now, this country happens to be Austria, and it's actually the worst. It is as much as 12% of the time. Germany and France, the two largest countries in the European Union, are not so great either, at the 6% range. You would expect the countries of Eastern Europe to be more problematic in this regard, but the fact that Germany and France are this bad is quite interesting, in fact. And this chart on the left indicates the extent to which this bribery situation worsened from 2013 to 2019. So pre-pandemic, all of this is pre-COVID, Austria became the worst, as we just saw, because it also rose by the most. But number two is quite surprising because Luxembourg is a tax haven and one of the richest countries in the world, and also a small country. Yet you have to bribe the doctor to get an appointment in Luxembourg, and that situation worsened considerably, even though this is one of the wealthiest places in the world. That is really startling. So this is the ugly truth about healthcare in Europe, which is that you often do have to bribe the doctor to get a faster appointment than other people in line. And also remember that in any government-based healthcare system, doctors are government employees, which not only means they're paid less and therefore less inclined to do their best, they also are more inclined to take bribes because that is what government officials do in all countries. But by making healthcare part of the government, you also create a bribery practice. And that, like I said, is the worst aspect of capitalism because people with more money who are also more shady will get better treatment. And for all the problems that the U.S. healthcare system has, which are many as I described, bribery is not one of them. If you have an HMO plan like Kaiser in the United States, you cannot bribe the doctor to get something better. That is just not an aspect of the HMO-based healthcare system at all. So in conclusion, both the United States and Europe have some very problematic aspects to their healthcare systems that are very different from each other, but neither place has created a healthcare system free of these major flaws. It's just that the flaws in the US system are much more well known. Thanks for watching.